Sex education in schools. Having sexual thoughts and feelings are natural for teenagers, but due to the lack of knowledge about sexual activity, teenagers can make mistakes, which are stressful as well as harmful. Therefore, sex education should be in schools to prevent sexually transmitted diseases and teenage pregnancy. Contraceptive use also should be taught in school to prevent teenagers from early teenage pregnancy. Sexually transmitted diseases are infectious diseases that spread from person to person through bodily fluids. When a younger person starts having sex, it increases his or her chances of becoming infected with a sexually transmitted disease. STDs are sexually transmitted through having sex anal, vaginal, or oral. Some sexually transmitted diseases have serious effects and life-threatening causes. For example, human immune deficiency virus can cause acquired immune deficiency syndrome. There is no cure for this disease. HIV/AIDS can be transmitted through contact with infected blood, semen, or vaginal fluids. HIV/AIDS weakens the immune system, which helps fight off disease-caused substances. Teenage pregnancies can be prevented, but there's a lack of parental guidance when it comes to what causes pregnancy. Most parents avoid talking to the children from talking about sex. This avoidance often leads to teenage pregnancy because the teenager engaging in sexual activity has not been properly educated about how to avoid teenage pregnancy. However, teenagers must go through social and emotional changes in life. Peer pressure is a major factor that encourages teenage boys and girls to indulge in sexual activities. Peer pressure often happens when teenagers do not want to be alone or left out. Some teenagers are influenced by their peers to be included in a certain group. Contraceptives should be taught in schools to prevent teenagers from contracting sexually transmitted disease and falling victim to teenage pregnancy. Vagina rings, birth control pills, condoms for males and female condoms are used to prevent teenage pregnancy and diseases. When contraceptives are being taught in schools, should give parents, teachers, faculty, and staff a sense of relief. If it is important to teach teenagers how to make important decisions that protect both their bodies and their mind. Sex education should be in schools to prevent teenage pregnancies and genital herpes, HIV/AIDS, human papillomavirus, chlamydia, syphilis, and gonorrhea. Contraceptive use also should be taught to prevent teenagers from protecting diseases and early teenage pregnancies. Awareness and prevention is key to preventing sexually transmitted disease and teenage pregnancies.